Dear ladies and gentlemen, thank you so much for the opportunity to introduce you the results of our study. There is no disclosure. The aim of our study is to validate the Caprini score in patients undergoing varicose vein surgery, especially in the vascular procedures, and to identify individuals at the elevated risk of postoperative VTE who will benefit from prophylactic anticoagulation. This is analysis of ongoing registry study CAPSIVs, which includes patients who underwent treatment for varicose veins for any intervention and who is followed up for 28 days with ultrasound performed between 2 and 4 weeks to catch any kind of DVT, especially asymptomatic DVT and in the venous heat-induced thrombosis. This analysis was performed in February 2022 with a number of records 1878. You can find here demographical characteristic of the patients. The Caprini score ranged between 1 and 12 with a mean of 4. And the most important risk factors of the Caprini score you can find here in presented diagram. The prophylaxis consists of elastic compression that was used almost for all of the patients, and pharmacological prophylaxis that was used just for 20% of the patients. NVT event was detected for 63 patients, that is 3.4%, any DVT in 39 patients, and HIT in 28 patients. The location of DVT mostly was presented in cuff muscle veins, one case in peroneal veins, one in femoral vein, and one in femoral and iliac vein. Bleeding was detected in 2 cases and were represented by clinical elements of uterine bleeding at the top of the prophylaxis with the docs. There was a significant correlation between the Caprini score and incidence of VTE, but we couldn't identify the cutoff of which specificity and sensitivity could predict the development of postoperative VTE. Here you can find the predictors for VTE. We found in the single-factor regression analysis that hemoprophylaxis type and duration of hemoprophylaxis was a risk factor. And we decided to make a separate analysis for hemoprophylaxis as a predictor for VTE. Here you can see that 1 day of hemoprophylaxis is not enough, but also prolonged hemoprophylaxis is not always working in positive side because of the individual history. Also, there was analysis between Caprini score in patients who did not receive anticoagulation, and we found significant correlation and significant predictability without any satisfied cutoff, which could predict the development of postoperative DVT. Caprini score became a significant predictor in the single factor and multiple factor regression analysis. And together with the removing of the tributaries and removing of the perforating veins were the more important and significant risk factor for postoperative VTE. And here you can see the diagram with separating patients for risk groups and relevant prophylaxis. Low risk, no routine hemoprophylaxis, moderate risk prophylaxis 7 and more may be suggested, high risk from 7 to 30 days, and patients with individual history of VTE, hemoprophylaxis for 30 days and more. Conclusion: the incidence of postoperative VTE after modern vein surgery is 3.4%, is predominantly represented by asymptomatic DVT and HIT. The incidence of symptomatic VTE at 28 days after modern vein surgery is 0.5%. Caprini score demonstrates a significant correlation with the risk of postoperative VTE, and according the group of the Caprini score, prophylaxis anticoagulation for 7 days and more may be suggested for individuals with a Caprini score for 7 to 10. From 730 days for Caprini score 11 and more, and prophylaxis for 30 days and more for patients with an individual history of VTE. Thank you for your attention.